Hello, HubLE audience. This is Carmen Huesa. I'm a research fellow at the University of Glasgow in Scotland, working in osteoarthritis and that sort of stuff. And today I'm interviewing Morten Steen for his abstract in ECTS that he presented not long ago during the conference. So Morten, up to you.
Yeah. Hello, my name is Morten, and I'm a clinician. I work at the Department of Endocrinology at the Odense University Hospital in Denmark. And I presented my abstract at ECTS just a couple of weeks ago, where we looked at the incretin hormone GIP and how it affects human bone cell activity. Yeah.
Cool. You want to give me some more details about your work and what it entailed? What was your in vitro, in vivo?
Yeah.
Mm-hmm.
So what we look at is this. So normally GIP works when we eat and is secreted when we eat and is responsible for the incretin effect, in which we increase insulin secretion after nutrient intake. But it's been observed that GIP also decreases markers for bone resorption in vivo. So we did in vitro studies using human osteoclasts and osteoblasts to kind of get more like an insight into the mechanisms of how GIP works. So what we observed was that GIP is anti-resorptive and might uncouple the process between osteoclasts and osteoblasts. So it decreases the osteoclast activity without changing osteoblast activity. We also found or showed that the GIP receptor is expressed in human osteoclasts using different methods, in situ hybridization and RNA sequencing of human osteoclasts. And then we did some signaling studies in which we could show that GIP changes osteoclast activity by activating GIP receptors on human osteoclasts.
Really nice work. So did you manage to find out the pathways in which GIP is acting?
Great question. So thank you for that. But so at the moment, we are looking at different inhibitors, trying to identify which pathways are being affected by GIP. And we're getting close, and I really hope that these data are ready to be published, or at least submitted for publication by the end of the summer.
That's really exciting then. So can I ask, because most of the time we always end up having treatments for stuff like osteoporosis by targeting the osteoclast, and it's always the elusive enhancing bone formation that goes away. So what do you see the application for this in the future as well?
Yeah, thanks. I think it's a good perspective for trying to identify new target for treating osteoporosis, because although that some of or most of the drugs we have target the osteoclast, then if there's a patient that for some reason doesn't want to have bisphosphonates or is allergic or whatever, then it's still an effective treatment. And if we could then identify other drugs that are mimicking hormones that we know about that could have the potential same effects, I think that would be kind of interesting to use. But the problem with GIP is that it's short half-life, so we need to have it needs to be changed so we have a longer half-life, like we know from GLP-1 receptor agonists, and definitely long-term GIP receptor activation in vivo, and see if it changes bone mineral density or bone strength in humans are kind of interesting, and I think that's the perspective of this, that there seems to be a role for that.
Yeah, and I guess in a sense is something that you give at the time. It's not like bisphosphonates that 10 years later you're still having to deal with the effects of that. So thank you very much, Morten. I hope you enjoyed the ECTS online meeting.
Very much.
Very much. That's good to know. And I'm very glad you came in today and you let us know about your work. I'm sure the HubLE audience is going to find it really, really exciting. And we definitely look forward to seeing your paper coming out.
Thank you very much.
Hopefully at some point this year.
Yeah, okay. Hopefully. Crossing fingers. Thank you.
Thank you.